Hello, everybody. I'm Lee Cade, and this is VINI. We're doing a special State of the COVID update. Today, we're joined by Fit APRN Clare Eggett. How are you today, Claire?
Hi, good morning.
Good morning. I really hate the fact that we're still talking about COVID almost a year into it, but that seems to be the predominant feature of our lives right now. How are things as far as the state of Utah and COVID? It's not a pretty picture right now, is it?
Yeah, we're unfortunately experiencing a dramatic increase in the numbers of COVID cases and also the numbers of hospitalizations and ICU bed usage in the state of Utah. And really concerning that we're going into cold and flu season where people could get influenza and other respiratory colds on top of COVID. There's many concerns that we're going to run into a space where we don't have enough caregivers to administer ICU needs or beds. So there's a couple of different things there that can be complications and many random complications in young, healthy people, inflammatory processes, heart problems, neurologic conditions. They're not very frequent, but they're very alarming. When they do happen, they're very severe. And none of us want that to happen to any of our family members or our colleagues or friends. And we just need to double down our efforts and be better about doing the things to prevent and staying at home, trying to behave this holiday season to try to really double down on our efforts to control this thing.
Now, when COVID first broke out, the CDC had some guidelines about masking, basically stating that masking was to protect other people from you. You're asymptomatic, but that's been reversed lately. They're saying that the mask can actually help prevent your susceptibility to picking up the disease. Do you have more on that?
This virus is spread by droplets. So we have to just assume that these viral particles are microscopic. We can't see them. And, anytime that we unknowingly touch our face or our nose, anything like that, we can actually spread, or we cough or sneeze, we can spread those little microparticles that you can't see. And by keeping our faces covered and other people keeping their faces covered, it's just common sense that we would be decreasing the spread of those particles to become infected. So I think it makes total sense, actually.
Now, with mask wearing, again, it's a droplet spread virus. Are there times that it's okay not to wear a mask? I like to go for a walk every morning just to get my brain moving. If there's not a fresh influx of oxygen, I'm pretty much a brick. Is it okay for me not to wear a mask if I'm not close to people?
Definitely. I'm a big outdoor lover. Everybody who knows me knows that. And there's nothing better than being able to go on a run or a walk or do something out in nature, getting that fresh air. And I believe that that's very healthy for you and you should do that. You need to be conscious that wherever location you're going to, if it's going to be crowded with people, obviously then a mask may be appropriate. But if you're going somewhere where you can keep distanced from people and you're going to be outdoors, then going on a walk by yourself would be appropriate place to kind of get some fresh air and take your mask off. If you're sitting in your own backyard by yourself or your own front yard and you're, enjoying some sunshine, that might be also a very appropriate place to get some fresh air and not wear a mask. But definitely there's some trailheads that are very busy or something like that. If you frequent a ski resort or something like that, there's going to be people, even if you're outside, a mask may be appropriate. So use common sense there. But yes, I think getting fresh air and finding opportunities to have some of those outdoor experiences where you're distanced is still a safe idea.
I love that you brought up common sense because my wife, every time I go out, she's like, wear a mask. I'm like, well, I'm going to be careful. And she's like, I'm not worried about you. I'm worried about the other boneheads. So I bring the mask with. It's in my pocket just in case I end up with a large gathering of people who inexplicably just materialize at the park. With the governor's new mask mandates, some of the other things that have been put in place is no gatherings of more than 10 people and to limit gatherings to folks within the same household. So what's the logic behind that? First, I was a little confused by that, especially when it comes to restaurants, because how do you limit a restaurant interaction to the same household?
I think that what they're trying to do is to limit the number of people, if there is a positive that could be exposed to that person, right? So, or an asymptomatic carrier, limit the amount of exposure. And so by decreasing our interactions to only our household, if somebody was asymptomatic, we would obviously not spread it as quickly. At a restaurant, you're right. There just isn't a way to, if you're going to a restaurant with somebody that's not from your household and sitting across from them unmasked eating your meal, there really isn't a way to to totally limit your exposure. So you've got to use that discretion wisely and decide if that's, if that risk is worth it. I think that the reason that they haven't closed down the restaurants and the businesses is because of the economic impact, not because it wouldn't be wise from an epidemiology standpoint. If we're really trying to limit it, it might be the right thing to close the restaurants. The restaurants don't know who's from what household, and we've got to really be accountable to ourselves for that.
With the holiday season basically here, we have Thanksgiving just a week away, essentially. There are some people that are hoping that the governor's mandate's going to change just a little bit and that things are going to reverse just a little bit for the upcoming Thanksgiving holiday. But what should we be keeping in mind when it comes to, say, Thanksgiving or getting together with family or people outside of the household? Is that a thing we should really be doing? Or should we be doing this?
The truth is that according to the governor's mandate and all of the things we know about the transmission right now, the transmission rates and the spread of COVID, we really should be postponing any family gatherings with even our own immediate family. I know it's heartbreaking to some that just really wish to be with their family, but I think we've got to be cognizant that if we potentially could put at-risk people in danger, our elderly grandparents, the young, the immunocompromised, and we need to think of that sacrifice of maybe not getting together this year as an opportunity to have more years together, because definitely could have mortality impacts and morbidity impacts on our own family members if we choose to disregard that message. It is much safer for us to stay in our own homes, do our own household Thanksgiving dinners, and opt out of a big family gathering this year. So that is what's recommended. And I know my family personally is sticking to that plan so that we can keep each other safe.
And you were saying you come from a large family. It's been a tradition forever for your family to get together. But I love what you're saying. Maybe we sacrifice this Thanksgiving so that we can ensure that we have the family together for others, right?
Correct. And my family is trying to be creative about it, and they're using Zoom calls to do bingo together, and they're trying to go around the table still and do their what we're thankful for, and we're really trying to be improvising and creative about it, really out of care for each other.
Now, this virus seems to be a little on the clever side. It hides in plain sight, and it has a little bit of a ability to adapt and change to its environment. So the mutation rate seems to be, I don't know, I don't hear about influenza mutating multiple times during the course of a year. Maybe it does, and I just don't understand the virus that well. But really, how much longer are we looking at with this? I know there's vaccines on the horizon, but
that's the $1 million question, honestly. I don't think we know enough about it. We're still learning every day kind of the behavior of the virus. The epidemiologists who are working very hard to understand still don't have a total understanding or rap sheet on this thing. We do know that the immunity, if you've gotten the virus, seems to last for at least 3 months, maybe a little longer in some people. But we are seeing reoccurrence rates where we have somebody who has a confirmed positive case in the springtime. They had immunity for a few months, and now they've tested positive. I've had a couple of those patients personally that have tested positive again 6 months later. So that's concerning because we just really don't know what's going to happen or how the function of the virus is going to kind of recur or whatever. So I think that the message there is with the vaccine coming, even if you have a vaccine, there's 90 or 95% immunity for a period of time that we don't clearly understand. So even if you've gotten the vaccine or even if you've had the virus and there's some suspected immunity, we've still got to understand that we don't totally, everybody's body is a little different. Everybody's immune system's a little different. And we just really need to be responsible and thinking ahead that, hey, we still need to proceed like with masking and with hand washing and with careful behavior until we really have a clear handle and understanding of the virus and how it's going to proceed in the years to come. We have to do all the cautious things, which would be to wear our mask, wash our hands, stay alert, and double down our efforts to not transmit it to anybody else. So it's tricky. You're right. It's a tricky thing, but we have to all take personal responsibility and accountability for it.
I know that your schedule today, especially considering that you're at the front line of making sure that Valley's employees and actually quite a few of our clients are staying healthy. But I wanted to talk briefly about some of the unseen complications that come up with COVID. I'll use myself as a quick example. I had a respiratory infection about a month ago. It sure sounded like COVID. There was a cough. There was a shortness of breath. other fun things. I got to go up and have Cassidy swab my brain real quick. Luckily, it came back negative, but I mean, I'm still dealing 3 weeks later with a lingering cough. Just getting in to get a chest x-ray, just getting results for that, just getting scheduled to get the test, just getting the time to wait for the test. It was nearly a week before Chano was even able to figure out what to do, right?
Yeah.
And that was a month ago before ICUs were as full as they are right now.
Right. That's a perfect example, though, Lee, about the process and the kind of congestion in the healthcare system. So we figured out now how to get some rapid testing done here at the clinic where we can get a pretty good idea within 15 minutes of whether you need the swab your brain PCR deep nasal pharyngeal swab. That test still is taking a couple of days to come back. And we have to remember that there's a period of time where we could test somebody right away if they've had an exposure, but it takes 5 to 7 days for the viral replication to build up in the system. So we could test them now and get a false negative, and then 5 days later, they're positive. And that, coupled with the volume of patients that we're talking about in the system, really impacts the access to the healthcare. So when we order all the hospital and imaging locations and labs and all of those things are on high alert as well. And so they're limiting the volumes of people that can come in for an x-ray, that can come in for a blood draw, that can be seen at particular amounts of time, because they have to kind of mitigate and manage the risk for those people coming to the hospital too. And so what we find is that there is an impact even at this kind of outpatient level in getting services that we need for patients. What we have to understand is that personal responsibility that comes down to, not getting together for Thanksgiving, it really trickles into the bigger picture, which is the whole healthcare system. And really that personal accountability leads to better access for those that are severely ill and that have severe symptoms, or that have lingering problems that maybe aren't COVID, that we still need to have them treated and seen for by some of us, or all of us, taking personal responsibility to stay healthy and to do the things that we need to do to providing better access and not congesting the system for those that have more severe symptoms or more persistent symptoms and need the resources. It's a really accumulative snowball effect that I think in my lane of healthcare, I really see what happens here in the outpatient world is impacting what happens in the acute care settings like urgent care and ER, and also into the ICU and hospitalization, more severe patients. So we all have to see that path and really take our own responsibility for it.
Absolutely. Yeah, I was thinking this would not be a good time to get in a car accident or trip and fall and have to go to the ICU for long-term care or short-term care, regardless. So Claire, I really appreciate you taking time to talk with us today about COVID and where we're standing here as a state, as a nation, and as an organization. Thank you so much.
You're welcome. Thank you, Lee.